Since most of you are juniors or seniors in high school, you know all about trying to fit in and trying to avoid public humiliation. Just for 1 minute, I'm going to ask you to put yourself in a practical and very common situation. Imagine yourself in gym class wanting to play basketball or badminton, but something is holding you back from participating with your friends. You have hyperhidrosis, which is a condition in which a person sweats excessively and unpredictably. Not only does your condition affect you in gym class, but also while just sitting in the classroom. Your hands sweat so much that you turn your papers in with wet spots on them. Now what if I told you there was something you could do to help your condition? You would be willing to do anything, right? What about Botox? I know, it sounds absurd to use Botox for non-cosmetic purposes, but I think you would be surprised at all the FDA-approved uses for Botox. Because I have completed an internship at a doctor's office that offers Botox, I'm very familiar with its uses. There are several medical uses for Botox. Botox is a type of medicine used to treat patients with certain neuromuscular conditions. According to clinical findings and BotoxMedical.com, Botox treatment is first-line therapy for cervical dystonia, which is a painful condition in which your neck muscles contract involuntarily, causing your head to twist or turn to one side. Botox treatment can stop or greatly reduce neck pain and muscle spasms, improve head posture, and reduce intensity and frequency of neck pain. Botox blocks the nerve signals that cause muscle pain and spasms. Blepharospasms is any abnormal contraction or twitch of the eyelid. Botox treatment is injected directly into the affected eye muscles to block the signals from nerve cells and help relieve the muscle spasms. The third condition that can be treated with Botox therapy is strabismus. According to the American Association for Pediatric Ophthalmology and strabismus is when muscles tighten around the eye, resulting in the pulling of the eyelid of the eyeball to the side, also known as being cross-eyed. Upon Botox injection, the muscles weaken and spasms are slightly reduced, allowing the muscles on the other side of the eye to contract. Through this dual action, Botox treatment is thought to correct cross-eyed. Botox is a prescription medicine that is injected into the muscles to prevent headaches in adults with chronic migraines. Botox is also injected into the bladder muscle and used to treat the leakage of urine in adults with an overactive bladder. Botox is also injected into the skin to treat the symptoms of hyperhidrosis, like the example from my introduction. Botox is also used for cosmetic purposes. Botox is injected into the muscles and used to improve the look of moderate to severe frown lines between the eyebrows. Botox cosmetic is only a temporary fix for the frown lines, but the treatment may be repeated. In all Botox, a teeny tiny needle is used, like the one I have here. I got this from the doctor's office I interned at. Its exact size is 30 gauge, which is really, really tiny. I'll pass it around. And it makes Botox basically painless. During Botox, a small amount of the actual medicine is injected several times over the problem area. So, say you're doing it on your face, it would just be like little pokes with small amounts of injection, like multiple times on the face. And it would be the same for your hands with the hyperhidrosis, or your feet for the hyperhidrosis, or your underarms. Although it seems simple, there are some concerns with Botox. Sometimes bruising occurs at the injection site from a needle hitting a capillary. Also, from the cosmetic standpoint, unevenness is a possibility. So you need to make sure that the person doing the Botox makes it even. if they inject too much on this side, it'll look different from this side, you know. I hope I've taught you all a lot about Botox and proved that Botox is not only used for cosmetic reasons, but can help with serious medical conditions.